Hi, welcome to another episode of Med Nature Dr. B, and today we're going to be looking at the abdominal examination. So basically, we'll be doing a quick general survey, inspection, auscultation, percussion, palpation, and some amazing special tests. Now, this special test will be specific to different organs and legs. Okay, so let's get to it. Hi, good afternoon. My name is Dr. B. What's your name, please?
John Doe.
Oh, okay. Please, how would you like me to address you?
John is fine.
Okay, thank you. So today I'll be doing physical examination on you, specific to your abdominal region. So first thing you observe is while your patient is coming in, you check for any form of distress. So you're looking at your patient from head to toe. Now you're looking for any sign of gastrointestinal distress. So what position is your patient in? Is your patient bending? Is your patient having difficulty to speak? Is your patient sweating? That first is all these you observe. Now, in a situation whereby your patient is in no form of distress, then we go into the general survey. So you're starting from head to toe. Now, by the way, don't forget you cannot afford to miss your vital signs. So you're checking for temperature, you're checking for blood pressure, you're checking for the pulse, BMI, very important. Now, let's go on. We'll start from the head and we'll look forward. There's no sign of hair loss, no sign of alopecia. This could be due to any form of malnourishment, iron deficiency, and the likes. Now, we go to the face. Now, I'm looking at my patient. So I'll tell my patient, please can you look up for me? Good. No sign of conjunctival pallor. Now, I'll tell my patient, please can you look down for me? No sign of jaundice. Thank you. Then, also I'm seeing that there's no sign of xantholesmus, corneal arcus. Now I'm checking for central sinuses. So both at the tip of his nose and at the lip. Now, also I'll tell my patient, can you open your mouth for me? Now, good. No sign of angular stomatitis, chelosis, oral ulcers, candidiasis. Now, you need to rule out all this. No sign of rotten teeth due to GERD, for example. Good. Now you can close your mouth. Thank you. No sign of glossitis too from the tongue. Now we go to the neck. Now the neck, I'm checking for any form of leaf adenopathy. So you can start the posterior region. Also, you want to check for the left supraclavicular fossa. So you're reading out what Virchow's nodes. So this is an association with metastasis from the abdominal region. Now we go right to the chest. Now I'm going to be asking my patient to remove their clothing. Good. So now we're going to be checking my patient's chest. See no sign of spinal nerving. No sign of spinal adromatosis, no sign of pancreas. Now we go to the abdominal region. What do we start? We look at the skin first of all. So I see no sign of scars, no sign of purple striae. Now we now look at the umbilical region, the location. That's very important. We also look at the contour of the abdominal region. Is it protuberant or is it scaphoid? So the concave shape going inward. Now, also I look for if I can see any form of visible peristalsis or any form of visible pulsations. Good. Now, diving in depth, I go down. But before I go down, I tell my patient, please put your hand out for me. So you do this for me, dorsiflexor. Now, this is called the hepatic flap or hysteresis. So my patient is going to be there for like 15 seconds. So this is to rule out any form of hepatic, encephalopathy, and the likes. Now, also at that point I check for clubbing. Could you do this for me? So something called the shamrock window. So if the shamrock window is which is spreading my patient, no sign of clubbing, I'm checking for lychonychia. You put your hand on this for me. Cholionychia. I'm checking for any form of palmar arrhythmia. I'm checking for dupuytrenal contracture. Now, good. Or even any form of nicotine staining, which is not there, my patient. Now, also, I go downwards, see any form of sign of edema. pedal edema, renal. Now we can now go into inspection of the abdomen proper. Okay, now inspecting the abdominal region now. So you are basically going to be looking for any form of asymmetry. Now you're looking at contour, you're looking for any form of protuberance, like signifying ascites, you're looking for scaphoid shape, showing that there's a form of concave. Then, now also, you're going to be ruling out any form of skin markings, like petechiae, purpura, ecchymosis, any form of pustules. You're also checking form of, you're checking the lineal albor. If a woman is pregnant, you see the lineal nigra. Now, you also rule out two important signs, the Collin and Graves Turner sign. So the Collin sign is basically around here, and the Graves Turner sign is around here, signifying necrotizing pancreatitis. Then we now go to the umbilical region. At the umbilical region, you're trying to rule out any form of protuberance or protrusion or bulge from the umbilical region. So I'll tell my patient to cough. Please cough for me. Also, I'm checking the inguinal area just to rule out a meal when I'm to cough. Okay, now we also will be checking for any visible masses, visible pulsations, and the likes. Okay. So you're going to be looking out for any form of distended veins, like in case of caput medusae, and you're also going to be looking out for protruding nodule just around the umbilical region here, called the system region subnodule. It's associated with metastasis from malignancy of the pelvic region or the abdominal region. Okay, now we move to auscultation. Very important. We have 4 quadrants in the abdominal region and we have 9 regions. When it comes to auscultation, you're going to be looking at the 4 quadrants. So I'll be using the diaphragm of my steps, and you're going to be listening to the vowel sounds in the 4 quadrants. Now, you're going to listen for full 1 minute in each quadrant. So you're going to hear the voices are usually high pitched and like 5 to about 34 clicks or gurgles. We're looking at, for every region, we look at a special test under it. So on auscultation, a special test under it, we will start with breath. So there are 4 regions we look at breath for. So we start with the epigastric region, listening for the aortic breath. And you're going to be listening to it with your bell. And you move laterally on both sides to listen to the renal artery, iliac, and femoral. And we are done for breath. Then we do something called succussion splash test. Now this is basically it. You place your diaphragm just at the epigastric region and you hold both ends and just shake. Now, when you hear a sloshing sound, it signifies some form of gastric outlet obstruction or colon obstruction. Okay, then we also listen to something called the hepatic or splenic friction rub. So, same thing. You go to the right upper quadrant region and the left upper quadrant region for the spleen. So the liver, the spleen. Full 1 minute. And then we're done with the auscultation. Now we move on to percussion. Okay, now when it comes to percussion, the first thing you should note is what kind of sound should be elicited. Now, because the abdominal region is noted for gas, fluids, and feces, basically, you should expect a tympanic sound. So watch me. We're going to be using the 4 quadrants rule. Now, on percussion, you're going to be using your left dominant hand, place it on the quadrant you're after, and go for the GIT joint. So you hear like a drum-like sound. So that's timpani. Now, if I had PERCUSSION and it had some form of dullness, okay, then I should be worried because there's form of obstruction or any form of pathology going on at that point in time. Now, there's some specific tests under percussion. The first one is going to be, we're going to be percussing the liver. So first of all, look for your mid-clavicular line. And you're going to be percussing from your right iliac fossa upwards until you hear dullness. And from the nipple region downwards, you'll be hearing resonance initially, the moment you hear dullness too. The span should be at the mid-clavicular line should be between 6 to 12 centimeters. The span, the liver span at the mid-sternal line is between 4 to 8 centimeters. So let's do this. Okay, so you note the point, then you start from here. You hear what? Resonance initially until you hear dullness. So from this region to reach this region is where the liver span is. Okay, then we're done with percussion of the liver. Let me go to percussing the spleen. Now the amazing thing about percussing the spleen is there are two methods. We have something called checking the trap space, and also checking the second one is checking the Castell's point. So come with me. So the trap space, we're going to be checking from, you try and first of all locate your mid-axillary line, and that space just above your landmark is the sixth rib. Below your landmark is what? The edge of your costal margin, and when it comes to medially, the sternum. So just around there. And what do? You percuss. Now, you can hear what we're hearing here, tympani. If there was dullness, it signifies what? Splenomegaly. Now, Castell's point. Castell's point, you just look for what? Your anterior axillary line. So, then what do? Now, at the location of your lower costal margin, and what do? You percuss. So, if there was any form of word, splenomegaly, there will also be what? Dullness then. Then we go later on for percussing what? The gastric bubble. The gastric bubble, basically, you go below the left costal margin, the left. Same in your word, your left quadrant, upper quadrant, and you percuss. You should hear tympani also. Then you also percuss for the bladder. So usually, in a case of any form of bladder fullness, could be due to pregnancy or any form of mass, something, you hear dullness. So you just come here, suprapubic region, and oh, tympani. But if there's any form of mass or any form of tumor there, it would rather be what? Dullness. All right, then we go to palpation next. Thank you. For palpation, we're going to be using the 9 region rule instead of the 4 quadrant rule we've been using since inspection. Now, so basically, what are the 9 regions? Epigastric region, right hypochondria, left hypochondria, umbilical region, right lumbar region, left lumbar region. Then we have what? The hypogastric region, right iliac and left iliac. So let's go. The first thing you do is what? You do light palpation. So watch. What are we checking on light palpation? We're checking for tenderness, rebound tenderness, any form of muscular resistance. We're checking for rigidity. You're checking for any form of light mass on light palpation. Now, then we go to the next step, doing what? Deep palpation. So you put your left dominant hand on you, and you put your dominant hand on you, and you go more deeper. Now, what are you looking for now? You're looking for large masses. Nodules. Oh my God, nodules. You're going in, and lay down. Now, you're also going to check for liver size. You're going to palpate the liver, you're going to palpate the spleen, you're going to palpate the kidneys. So let's get right into it. Let's start with the liver. So there are two methods. You either start with coming from the right iliac fossa region. You tell our patient, please can you take a deep inspiration from breathing and hold it. Okay, you can exhale. Now you can literally see the edge of the liver, which will be what? Just rubbing through your hands on that deep inspiration. Or you do the hook technique, which is very, very good and also easier with patients who are obese and relaxed. One method is using the hook technique. You're going to the right costal margin and to check for the edge of the liver. Now, then we go next to the spleen. For the spleen, I tell my patient to breathe in and out, and I go diagonally from the right iliac region to the left hypochondrial region. Okay, so breathing out, breathing out, breathing out, breathing, breathing. Okay, so what are we looking at? Don't forget that when the spleen enlarges, it enlarges anteriorly, medially, and what? Downward. Now we go to palpating for the kidneys. So you use your left dominant hand and go posteriorly at the flank region, so that lumbar region here. And what do? You use your dominant hand. You use your left dominant hand to push forward, and use your dominant hand just to see if you can palpate the kidneys. Usually, normally, you can't palpate normal kidneys. It's usually very difficult to palpate the normal kidneys. Now, except in a pathological scenario. Now, after that, then we palpate for the aorta. So basically, you put your hands this way, and you see forward aortic pulsations, and we're done. Now we move on to our special tests. Now, we're going to be starting with the gallbladder special test, which is called the Murphy sign. So you go to the right upper quadrant region below the right costal margin, and you place your hand. Tell your patient to breathe in, taking a deep breath. Taking a deep breath. Out. Now, when you're taking a deep breath, that period whereby the gallbladder meets your hand, if it has some form of cholecystitis and lack, you'll be in severe pain. Now, that's Murphy sign. Now, we also have something called the Murphy sponge or the costal vertebral angle tenderness. So, watch me as I tell my patients to assist me with this. Now, so the costal vertebral angle tenderness. So, just right here, where the ribs meet the vertebrae, and you slight punch. Don't do severe punch. Just a slight punch on both heads. If your patient has any form of pyelonephritis or nephrolithiasis, screaming pain. Good. Now, we also have another special test, which is called the hepatojugular reflux test. So watch me. I first of all make sure my patient's bed is at about 30 to 45 degrees. Then I go to the right upper quadrant region and I do just deep palpation and see if there'll be any form of what? Jump at where? The jugular venous area. So this is to check out for jugular venous distension using the abdominal region. Okay, then we're going to the next test, which is the ASCITES test. We have two we're going to be doing today. So we have the fluid wave or fluid tree. Now, so basically, you put your left dominant hand at one side, and I'm on my left area, and all you do is just what? Tap What are you observing for the transmission of wave due to the fluid retention, the abdominal region? That's fluid trill or fluid wave. They also have another test called the shifting dullness. So what do I do? Now for the shifting dullness, now I'm going to be percussing from the umbilical region now to where I get dullness. So then I ask my patient to move in lateral decubitus position away from me, and I percuss the same location. So in case I hear resonance there again, it signifies what there's a shifting word, dullness. Alright, so we move on to 5 special tests in appendicitis. And we'll be starting the first one, which is called the McBurney's test. So we're looking for the McBurney's point. So the McBurney's point is found between your umbilicus and your anterior superior iliac spine. So it is 2/3 from your umbilicus, by the way, diagonally, then 1/3 from your anterior superior iliac spine. So all I need to do is just to palpate there for tenderness. If my patient has appendicitis screaming pain, then the next test I'm going to be doing is rebound tenderness. So around the lower, the right lower quadrant, I'll just palpate and remove my hand. On removing my hand, if my patient signifies pain, I ask the patient, did you notice the pain when I palpate or when I remove my hand? If it says when I remove my hand, the sign for rebound tenderness. Then I also go for the roving sign. The roving sign, you palpate in your left lower quadrant, and while palpating your left, the patient feels the pain in your right lower quadrant, it's positive for appendicitis. That's 3. Then we go next to a special test called the obturator sign. So the first thing I do is flex my patient's knee, then bring the leg outward but pull the thigh inward. So watch me, like this. And this is the obturator sign. If my patient is screaming pain, positive for appendicitis. Then we go to the psoas. Now for the psoas test, now I place a hand on a patient hip and I extend a patient's hip this way. If the patient has appendicitis, is going to scream in pain. Now, with that, that concludes the special test for abdominal examination. Thank you so much for watching this episode. Please don't forget to subscribe, like, share, comment. Thank you for being part of our community. Bye. See you next episode. Spider angiomatizer. Ptosis, no sign of gyneco. Looking for scaphoid shape, showing that there's a form of concavity.